This is a very special session, the first time in Spain that we have the topic of keratopigmentation on display. And I'm very honored to have my colleagues, Dr. Renato De Natalis from Italy, Dr. Alessandro Bosovic from New York, and Alessandra Mesti from Alicante, Spain. We shall try to offer to you a wide perspective of what is the present, future, and past of keratopigmentation, and to demonstrate to you that we're dealing with a very interesting and new type of corneal surgery. First of all, everything that I'm going to mention to you is independent, and all our studies have been performed with official grants from the Spanish government for innovation. Having said that, the problem that you have, and this is why I started with this topic, is what are you going to do with these eyes? These eyes are disabled. They have been for life suffering from a cosmetic disability, not to mention those places and those countries in which the eyes are the only part of the face that some women can show. And the issue is how we can improve the quality of life of these patients so much disabled. And this is why corneal pigmentation is not that new, because it was used already in the past in order to develop something that could improve the cosmetic appearance of these patients instead of using prosthetics or mutilating surgery. So keratopigmentation has been sought for a long time, since Galinos, as a potential alternative for cosmetically disabled eyes, and the patients obviously have many times that you need to apply that, because not always they can tolerate a cosmetic contact lenses, not always they want to have a prosthesis, not always they are successful as well. We have cases in which corneal transplantation is unethical because there is a lack of corneal tissue worldwide, and finally the mutilating prosthesis is not allowed in some cultures. So this is the issue why we need keratopigmentation for therapeutic cosmetic purposes. But you think about functional purposes, we need to have something for iris coloboma, failed peripheral iridectomies with important disability because double vision of glare, total or partial anuridia, erected pupils with photic symptoms, diplopia, and iris pigmentation defects with related disability. All these patients are functional, they are not cosmetic, and they deserve also attention. So this is one of the cases, in this case, 24 years old young lady with a progressive endothelial dystrophy. This patient has endothelial dystrophy, has progressive iris atrophy, and what are you going to do? This eye will become decompensated. You do anything intraocular, and this is one of the cases in which we had a very successful outcome. This case is published. Up and right, you have a PI that was causing a lot of trouble to the patient, especially at night, how we cover just with a patch of pigment, and down you have a case that was following phacoemulsification, left because was IFE syndrome, with this defect in the perimeter epithelium causing a lot of disability. These cases were all treated with this way. And on top of this, and working normalized as we did from the beginning, we realized that we could change on voluntary basis the cosmetic appearance of the eye for purely cosmetic purposes. This is one of the first cases in which we went from this to this appearance. That is a real case that we did now 10 years ago. So we're not talking about something that doesn't have a long-term outcome. We have long-term outcomes that we're going to show to you at this moment. Actually, this is the first paper published in which we describe keratopigmentation as a possible technique to change the apparent color of the eye with 4 years follow-up. That means that we were starting in 2011 practicing cosmetic keratopigmentation for purely cosmetic purposes. So today, should we consider keratopigmentation as a new emerging type of corneal surgery because we have scientific evidence to support it. We use CMR pigments. We specifically design new instruments that are specific for keratopigmentation, and moreover, there is a scientific society that at this moment offers an umbrella for control, for understanding, and offering a forum for the debate in the progress and ethical practice of keratopigmentation, which is the Keratopigmentation Society, headed by the Keratopigmentation Club, and this is the logo of the society that is at this moment created and is going to be available for all of you interested in the topic. So this is not only that, we have since 2023, we have 24, the first color meeting that is very important because it was the first time, and this happened in Alicante, in which we offer to the public the evidence available for the most important opinion leaders in this topic. Last year it was celebrated in Dubai, next year will be celebrated in Nice, and I anticipate to you that this is an emerging, a very high-speed process for cosmetic keratopigmentation to be applied as well as therapeutic. But is this that new? Is this something that we have been happening? I want to offer to you a historical perspective of how this has happened. Galin, in the first cycle after delivery, was the first to use chemical products in order to change the color of these disabled eyes. Later on, the story continues and is rediscovered in the 19th century by Louis von Becker and James Taylor in UK, and they offered the first time specific needles and frequent bundles in order to apply the pigments inside the cornea. The pigments were a problem from the beginning because most of the pigments were transitory. Some of them obviously lack adequate sterility. Corneal toxicity happened as well, and at that moment there were no drugs to treat these complications, not even that they needed to know exactly what they were doing in terms of chemistry. So this was until the American Ophthalmical Society in the beginning of the 20th century, Louis Ziegler, that was an American doctor, really rediscovered in his thesis to apply for American Ophthalmical Society multicolor tattooing of the cornea in 1922. This is the first time in this 20th century that something officially was launched and supported by the evidence of the practice of this Dr. Ziegler. This is the thesis to American Ophthalmical Society. I'm a member of this society, and you have to have a thesis published in American Journal of Ophthalmology, at that moment the Transnational American Ophthalmical Society, very difficult journal to publish, and so it was really highly remarkable. He described the techniques to apply this technique in different ways. He displayed new instruments. He used the instruments of Ziegler in part, and he rediscovered the instruments of Taylor. So all of this happened until our group in Alicante started a new rediscovery offering scientific evidence. We have published about 20 papers on this topic, from basic translational science to clinical science, and here we have been showing to you how we started with the study of the pigments in experimental models, later on to apply in therapeutic cases anatomically and functionally, finally publishing different papers in which we use the long-term perspective about the topic, how the functional cases were treated as well successfully with this technique, describing superficial keratopigmentation and intralamellar keratopigmentation for the purpose, and finally the complications that long-term outcome in a series of papers that ended in the first book published in 2015 on corneal pigmentation 10 years ago, and now in this year, 10 years after, we have the second edition of this book that gathers the experience that we have now in 18 years of the use of keratopigmentation from the beginning of the story till now. So this is how the historical display is happening. Galin started in Greece in the first cycle after delivery. In 450, Aetius applied this in Rome, in the capital of the Roman Empire. Then there is a gap. Nothing happened at the Ziegler in 1922 published his thesis for American Ophthalmical Society, and then is when we started in 2000 with our first studies. Later in 2015, Alexander Mosovitz and Dr. Ferrari in Paris and Josh Bykov also in France, were applying this technique basically for functional, for cosmetic purposes, and it was Alexander Mosovitz in USA who is pushing more since that time about the international development of this technique, and it is now that in 2023 the keratopigmentation group international was born, and so we have now some conclusions about the need of a technique for cosmetic reduction of disabled eye detected as in the beginning of the story of medicine has been accomplished. Second, we have now a solution for these patients that was not existing before. It is definitely we have a totally and well-developed surgical technique at this moment, in which we still have to learn a lot about new pigments, and now we know about the history of modern keratopigmentation, which is a fact. So we have even one of our classes in this online course of the University Miguel Hernández with 300 hours of teaching activities online and in English. We have now one module of keratopigmentation because we think there is a new type of corneal surgery that the new surgeons, emerging young surgeons, needs to know. And I want to thank you very much for your very kind attention. Now, okay.